Are you an elder and having a harder time caring for yourself? Or do you take care of an elder? Do you worry that if you ask for help, someone will try and move you out of your home or put you in a nursing home? What are home and community-based services, or HCBS? And are there any services available for elders where you live? Are there options that let you get help at home while staying in control of the care you get? Do I get HCBS from Indian Health Services, or IHS?
Medicaid is the primary source of care for elders like you to stay healthy, independent, and at home. IHS and Medicare do not provide these services. Medicaid provides health insurance, as does Medicare, or an employer's insurance, and offers many choices for long-term care. One option is HCBS, which is our focus in this video. If you choose HCBS, you will work with a case manager to create a care plan that meets your specific needs. You can choose who comes into your home and when they arrive to help you. Your friends and family might get paid for the care they already give you. Home and community-based services are not only about getting the care you need, but are also more affordable. The cost of receiving services at home is less than the cost of care in a nursing home or assisted living. If you are eligible, the costs are paid by Medicaid. Services vary depending on the state you live in, and reservations or rural areas may have limited healthcare providers. HCBS waivers can connect you to caregivers who live in your area and might even be your friends and family. These caregivers receive pay, training, and support from expert staff such as nurses and certified nurses' assistants. Knowing you can get affordable, quality care right at home is reassuring.
What is a waiver?
Waiver is a federal Medicaid term that describes eligibility requirements that are different than regular Medicaid. Every state offers different HCBS options, and each state with a waiver offers different services. Waiver options vary, and so do the names. States all have different names for their programs. Not all states offer HCBS programs as described in this video. For example, Arizona, Rhode Island, and Vermont are a few.
I'd love to hear more. What services are available for waiver participants?
First, you would receive the comprehensive benefits of your state's Medicaid health insurance. Services depend on the state, but many services listed may be covered, such as doctor visits, hospital and emergency services, labs, x-rays, substance abuse treatment, prescription drugs, rehabilitative services, physical, occupational and speech therapy, audiology, hearing aids, home health, private duty nursing, dental, vision, mental health, and chiropractic services, as well as transportation to medical appointments. Services are offered for very low or no copay. Second, a waiver lets you access all the Medicaid insurance benefits in your state and opens the door to additional services you can receive at home. These services are based on your needs and may include home modifications such as ramps or grab bars and home accessibility adaptations, adult day services, assistive devices, chore and homemaker services, emergency response systems, in-home nursing, medical equipment and supplies, meals, participant-directed supports, personal care services, respite care, transportation to medical appointments, and other important places in your community. HCBS waivers let you decide how you receive care at home. You can choose agency-based options like adult day programs, home health, and private duty nursing. Your state may let you select an option where you hire and pay your caregivers, sometimes called participant-directed programs. Many states also offer hybrid options, including in-home agency-provided care and participant-directed caregivers that work together to accommodate your needs. Check with your state to see what options exist for hiring and paying your care team, including friends and family.
This all sounds great, but how do I sign up for a waiver?
The first action is to contact your state Medicaid office. In most cases, the application has two steps. You start with the financial application, which typically can be completed online or in person with the help of a staff member from a Medicaid application site. You will work with an eligibility specialist. Be sure to tell them you are interested in applying for HCBS because the income requirements for waivers are specific. The specialist will confirm that you meet your state HCBS requirements, which might include being age 65 or older, or having a disability, U.S. citizenship, and a resident of the state where you are applying, having monthly income that meets the waiver requirements, and having resources under the limit. Resources include money in your bank accounts or investments, but most states do not include your primary home and the vehicle used for your transportation. When you finish the financial application, you will be assigned a case manager based on where you live, who will come to your home and learn more about you and your needs. This process is known as the functional assessment and determines your level of care.
Wait, why does someone come into my home and ask me personal questions? Can you tell me more about this functional assessment? What if the case manager doesn't like me or my house? What if they want to move me somewhere else?
These are all good questions. Letting a stranger into your home can feel uncomfortable. The good thing is that your case manager is a trained professional with your best interest as their top priority. It's important to be honest about what you need help with, because this allows them to create a care plan specific to you. Let's face it, no one wants to talk about going to the bathroom or struggling to take medicine properly, but it's essential. The functional assessment is a tool to gather information about your health needs and what it will take to keep you in your home. Your case manager will also evaluate your ability to eat, bathe, use the toilet, walk, and take medicine. These are called activities of daily living. You are encouraged to have a friend or family member with you during the assessment to take notes, to ask and answer questions, to advocate for you, and to share your story. Waivers offer many choices for how you want to receive support that keeps you healthy while staying in your own home and community. We encourage you to look into what your state has to offer for HCBS. Check out the resource page attached to this video to help you get started.